This video is going to cover, as we had talked about in the past, the setting up the iPads and opening up and getting your scenarios started, as well as looking at how you can design your own scenarios and set up events within those specific scenarios. First thing is first, you're going to do just like we have done in the past. We're going to come in here, check in settings, make for sure that we're hooked into the orange router, and we are. All right, I'm going to go check the iPad. Okay, the other iPad with the monitor is also hooked up to the orange router, so we're good here. And we're going to tap to connect. The screen that you see here was the one that we'd seen in other videos where the guy was talking about you could put in a patient student's name. So you can put in here test, test, add no email. Of course, you would put somebody's real email address here. If you wanted to email them the scenario or email it to yourself. We're going to start off with cardiac arrest. That is the scenario that's there. You can start off with any scenario that is shown on the screen. And if you noticed, it was already preset for the Zoll X monitor. Once you have everything hooked up and ready to go, you'll just hit start. Now when you hit start, your scenario will start playing. And you also notice that you have two timers in the bottom left hand corner. One timer is counting forward, one timer is counting backwards. Remember that what's going to happen is this alarm will turn red. It won't stop the scenario will continue on, but it will just show you that your time limit is up. This would be especially useful if you're trying to achieve certain objectives within a certain specific amount of time. If you need to provide any inputs to the scenario while the student is running it, you'll start off, for example, this one here has a heart rate of 89. They confirm cardiac arrest. The checklist is already in there, so you could actually hit yes. They call for help. They started CPR. And now we have something that's changed a little bit. If you wanted to put in some weird pulse ox, just because sometimes pulse ox will pick up in cardiac arrest, sometimes not, then you can do that. If the rhythm, and once the rhythm changes into something else, then you'll just hit this next event. And now it's like the guy said in one of the other videos. When you hit PEA, it knows that it's going to zero stuff out. If once they get into a different rhythm, they've gone into VFib arrest, the person can defibrillate. Now on the student side of it, they're gonna see the rhythm and everything. You can actually come in here and if you don't want VFib, you can change it to something else. If you you can also put it where it will be refractory to the defibrillation if you would like. And You see how each event has been broken down. And this is what's stored in this specific pad. Now I don't have the student's iPad on because if I did, it would be alarming. Once you get done with this scenario, you will hit load new scenario. Of course, it's going to ask you, do you want to restart it because you're going to lose all the progress? You go yes, and off you go. If for some reason you don't like the scenario that you see here, you want to make up your own, you can come down to one of these general scenarios here. It's already got in 3 different events, so you can set this up however you would like. But let's say that we decide that this is going to be our we're just going to name this training scenario. Part of me says that's not spelled right. Now we have named this training scenario, so we can go in now, and this is our own scenario. We can set up for however we want it to be. If you want to, for example, this first one has a heart rate of 80. If we don't like that, let's say that this person is is someone who may be septic or has a fever, so we could run the heart rate up. We can set the blood pressure down a little bit lower. It'd be nice if I would actually hit edit. So let's start all over. You got to hit the edit button up there. I forgot to do that. Now, if you want, this is when your blood pressure is in this, like you see it here, it's coupled. If you want to uncouple it, and let's say, for example, you wanted to narrow the pulse pressure or widen the pulse pressure, you can do that individually. All right, we've got this, so we can actually come in here because we know that if they're shocky and they've got a low blood pressure, they may not have a good pleth. So we can change that if we want to. Our capnography, if they're shocky, we know that's probably going to be a little bit low because they're probably going to be tachypnic, but they're still not going to be perfusing that well. So they may be maybe breathing about 30 times a minute. And you can actually come in here and do and work with it a little bit more if you need to. So for example, we want to change what our pulse ox pleth looks like. We can change it here. We've got a whole bunch of options here. And if you want something specific, then you actually have a little bit to choose from here, already kind of pre-populated. So let's say that we've got somebody who has got a little bit of pneumonia going on. So we can change the pulse ox, the CO2 pleth for that as well. All right. We can also set it to where this can trend in over time. We want this to go in over a certain amount of time. Let's say we want this to happen over a minute and a half. We can actually set a timer where it automatically jumps to the next event if we want it to. If we want it to go to the next event based off of defibrillation, then we can do that as well. We've already we can add a different monitor if we need to. And as you see, so this will kind of mess with you a little bit. It kind of messed me at first. So I went through and I updated all my parameters. I hit update, and you notice it kind of went backwards for a few minutes. That I don't know why it does it. It just kind of messes. It will mess with you. So we go to the next one. We do the same thing. Maybe we decide we're going to give them a little bit of fluid. The heart rate comes down a little bit. Blood pressure stays about the same. The pulse ox might stay the same because we decided they might have a little bit of pneumonia. So the key is when you're setting this up, you got to look at every little detail, and you got to make for sure that these that everything stays consistent with the story that you're going to be telling in the scenario. And what I would strongly suggest that you do is actually write your scenario down a couple days before you're going to do the scenario. Let it simmer for a day or two, pick it back up and read through it and just see if it makes any sense to you, because it may not make any sense to you at all. All right, we've got all this set up. Hit update. Once everything is set up like we want it, come back up here, hit the check mark. Everything is good to go. And now we can hit start. Once we hit start, we're now pretty much on autopilot. If for whatever reason in this scenario something doesn't go based off of the events that you've got pre-programmed in here, you can go in and modify this thing and actually change. Now, as you see little blue bars going around the circles. Remember I set that some of this stuff was going to happen over a period of time. So you're going to actually see the vitals change, or whatever those parameters were, change over a specific time period like you had put in that event. So if you've got it where the heart rate's going to speed up, the heart rate will speed up over 90 seconds or 5 minutes or however minutes. If the blood pressure is going to trend down for the next 10 minutes, then it will slowly trend down over 10 minutes. And it's going to be basically set up where it's going to drop so many millimeters of mercury every minute, depending on how often they cycle the blood pressure. So that's one really neat thing about this. So you can actually have it set in such a way once they get through their initial vital signs, that if they're not doing something right, for example, one of these options could have been fails to treat the patient appropriately or fails to perform an assessment. You can actually click that event, and providing that you've not done a whole lot of changing between the initial vital signs and the second vital signs, that those vital signs would progressively change over a certain period of time. And you would get some type of, you'd get a change like you were looking for. Now, one thing that we do have is we're going to have that monitor running in the background. And when we do, it's going to be annoying. So you can actually hit sounds and use your finger to slide this bar back and forth. If you want to add different things in here, for example, it may say, it may ask you, hey, am I having a heart attack? Or, where's my husband? Where's my wife? Um, there are other sounds. There are bodily noises. You can make it cough if you would like. Make them wheeze, make them vomit. There are other things. The only problem that I have found with this is if you don't have I don't think we have the stethoscope that comes with the kit. I may be wrong. Sorry about that. The there's a specific stethoscope that comes with this kit that will make these sounds be transmitted into that stethoscope the way I understand it. But these sounds, you can play them through the iPad, and while it is not the same as listening to a patient, your students would still get the ideal of what's going on with the patient. You can add other things here if you would like, and then if you wanted to add labs, if you wanted to. So that pretty much is it. Again, you just it's very easy to change scenarios. There are a bunch that are already preloaded, so if you wanted to use what is in here, um, I would caution you. For example, this specific iPad has TSOPs on it that were put on here. If you're going to run scenarios and you see anything with a number on it, numbered letters, like you see 60A-3 chest pain, those are TSOPs. Stay away from those because those are what's going to be used at the end of the class. So I don't think it's appropriate to test them on the actual TSOPs that we're going to give them to test out of a particular program. All right, load new scenario. We're going to start all over again. Oh, we forgot to save it, so let's save it. There we go. Now we can load a new scenario. And we want to do infection. And you see there are other. And you can set up little subfolders however you like. And that may be something that we may want to talk about doing within the department is, for example, have EMT scenarios, maybe have one pad that was specifically for EMTs, another pad for advanced EMTs and paramedics, and then a third iPad just for TSOPs. I mean that will have to be a conversation that we'll have to have with Billy and Larry to see what their thoughts are on that. All right. That is all I have as far as going through some of this. It is actually, once you play with this a little bit, it is very intuitive, and I believe that it will be very user friendly. Well, thank you guys for your time, and we'll see you on the next video.